Long story short, when I went back for my hearing test, I've gone from 3% to 95% in my hearing coming back.
Health and wellness is confusing. There's a new trend every week. Everyone's got an opinion, and half the time you can't tell what's legit from what's just good marketing. And we get it. We're in it too. Welcome to Dialed In Health. I'm Melissa Goodwin. Every episode, we bring in the people who actually do this work. Providers, practitioners, the experts who see clients and patients every day. We ask the questions you'd ask if you were sitting across from them so you can find the right people, make better decisions, and feel confident about what's out there. Whether it's peptides, gut health, water quality, ADHD, biohacking, or something you've never heard of, we're covering it. So let's get into it. Let's get dialed in. So what if I told you there's a treatment where you literally just lie down, breathe, and heal? No pills, no needles, no surgery. Climb into the chamber, the pressure goes up, and you breathe pure oxygen, and your body starts repairing itself at a cellular level. Sounds almost too simple, right? That's hyperbaric oxygen therapy, and it's been used for decades in hospitals for wound healing and decompression sickness. But now, wellness clinics, longevity centers, and professional athletes are using it for brain health, inflammation, recovery, anti-aging, and a whole lot more. So what's real and what's hype? Who is this actually for, and what does a session feel like? And why is a clinic in the middle of South Dakota becoming the go-to name in the country for this treatment? Today, we're sitting down with the team at Midwest Hyperbarics to break it all down.
Hyperbaric medicine. So baric is kind of probably the Latin derivative, I think, of pressure anyway. And so hyper is high pressure, and pressure really trumps oxygen or anything. It's the pressure that matters. It's kind of fascinating too. We're sitting here at about 1,500 feet above sea level, and our pressure, because we have 100,000 feet of air on top of us, is about 14, 15 psi. If you go in these chambers behind us, or in front of us, they go down 30 feet underwater, 60 feet underwater, and the pressure will drive oxygen into your system. So pressure is actually more important than the oxygen concentration as far as the healing. But it's interesting, with the biggest thing when you're flying, you're clearing your ears, and you have to change because you have these air-containing spaces, and you have to open your eustachian tubes to clear your ears. Same thing when you're going under these into the hyperbaric chambers. You're constantly clearing your ears because you're dropping down so fast. The eustachian tubes are normally closed, and you have an air pocket in your middle ear behind your eardrum.
Okay.
And especially when you're landing, the babies start crying because they can't clear their ears. And everybody else, you look around, everybody's yawning, popping, clearing, opening their ears because as you're getting down, the pressure's getting higher, and you need to equalize that by opening the eustachian tubes. And so.
Okay.
So yeah, it is. It's way more extreme in water because, 100,000 feet of air is probably equal to 30 feet of water. As far as changing. If you go 30 feet down, you're at 2 atmospheres, and if you go 60 feet underwater, you're at 3 atmospheres.
Okay.
Golfer, what was that guy's name again? I talked to you about.
Payne Stewart.
Payne Stewart.
Yeah.
So they were flying, and they were in a plane at 30,000, 40,000 feet or whatever. And they normally would have a pressurized cabin, so the pressure keeps that 20% of oxygen into your lungs. Well, they apparently depressurized.
Okay.
And so they're flying up there, and then the air became so thin and no tension to push the oxygen into them. They all passed out, and then the plane flew into South Dakota and crashed because they were all passed out, and it's all because of the pressure. But even if you're at 40,000 feet and you're breathing 100% oxygen, you're still going to pass out because there's no pressure. And you can't.
Got it.
It doesn't push the air into your lungs. You can live in this hyperbaric chamber with a hemoglobin of 0. Dr. Boersma's name was in 1959. He exsanguinated these pigs essentially and put just clear plasma in them. And because they were at 100% oxygen and all that pressure, the pigs lived just fine.
Okay.
With a hemoglobin of 0. And if you would have cut them open, instead of red blood, it would have been clear serum.
Oh wow. That's amazing.
And then he replenished their blood, and they were fine, and they came out with no sequela. So,
well, usually we have the general health and wellness. We have diabetic foot wounds that won't heal. We've been able to save some limbs, so that's exciting.
That's great.
Anxiety, depression, fibromyalgia, and then just even people that have like heart issues, how they're able to get benefit. I mean, when I saw just the wide spectrum of everything, ADHD, anxiety, depression, you name it, and just anyone that just is already healthy, but they just want to feel even better.
Quick break. This episode is brought to you by Vitality Growth Labs. If you're a health or wellness practice and you're wondering why your phone isn't ringing the way it should be, Vitality Growth Labs builds the systems to fix that. Get found, build trust, fill your calendar. AI authority stacking, videos that connect with your clients, real tools, strategy, and execution that results in real revenue. Visit vitalitygrowthlabs.com or check the provider directory at vitalitygrowthlabs.com/the directory to find a trusted wellness provider near you. All right, back to the show.
The neuropathy compounds that, and then if their blood sugars are out of whack, if they're not in a good range, then it makes it even harder to heal. But really, the inflammatory process that your body goes through and that cascade, it just kind of gets stuck there. And so, whether it's an arterial wound, whether it's a surgical wound, whether it's an infected wound, we want to try to get you out of that inflammatory process and move you on to the next stages of healing.
I mean, by the time you think that it's too late and they're talking amputation, if you haven't done hyperbarics, you haven't done everything that you could have done. Being a private practice in a smaller clinic, we have that opportunity to get those patients in before they're meeting insurance criteria.
That's powerful.
I'm David Almdow. I'm a retired licensed engineer and a former auctioneer. Respect for what goes on here at Hyperbaric. It's been a life-changing thing. They wanted to amputate my foot and part of my leg. And thank goodness for Midwest Hyperbaric. I was able to get in here and meet Jada and some of the medical staff and save my foot, save my leg. And
it's been a long process. But every day Dave has a foot is a good day for Dave.
One could say Dave is one of our OG patients.
Yeah.
And arguably our greatest success story thus far. When it comes to hyperbarics, you're really talking about three things. I mean, we're putting more oxygen into circulation. We're creating stress on the system by what's called increasing our reactive oxygen species or increasing your free radicals, which a lot of people think are a bad thing, but they're really not. It's much like doing a workout or doing a high heat sauna. You're putting stress on the system so that you'll hopefully rebound to a more optimal level. And then you're adding pressure. So with that, you're adding that stress on the system that you add that immediate stress. And there's some benefits with that. I mean, you're kind of recharging up your body on a cellular level. So most people have an increase in their energy levels after their first couple of sessions. But a lot of it is your cumulative effects, that cumulative stress that you're adding to the system to rebound back.
Oxygen is not flammable. Oxygen is not explosive, but it is the ultimate electron receptor, and you can't have a flame without it. So it lights everything on fire. It's oxidizer.
Okay.
And so when you're filling these chambers with oxygen, and most hospital systems still do, it's just easy. You have liquid oxygen, or you have these big tanks, and they're 100% oxygen, and you just compress the whole thing with 100% oxygen, and the patient's in there breathing 100% oxygen. But if there's any spark, static, or anything like that,
Don't take your cell phone in there.
no. And so, even down to, all cotton pajamas,
Sure.
and even down to different oils and
Oh, wow.
essential oils and, nothing. You're supposed to go in like the good Lord made you, no any metal, anything.
Okay.
And if you do that and you're wearing a grounding pad and the chambers are grounded and everything is good, they're safe. There hadn't been a fire for years and years. But that if you don't follow the safety protocols and you do something wrong and you're in there at 100% oxygen and there's any spark, you'll die.
Sure.
Now these chambers, they were just like these, and the chambers stayed perfect, and nobody around them died, no building damage, no nothing. But both people inside
Sure.
died. What we do, like all multi-place chambers, we compress with room air, 20% oxygen. Now it goes up to 40 and 60% equivalency when you're at 3 atmospheres, but it's much less.
Sure.
And we actually are venting these chambers too. So we're actually keeping the oxygen around the patient below 23.5%. And so there's almost no chance of a fire. Why home chambers are really good, especially hard home chambers, is because of the advent of oxygen generation. We can generate oxygen extremely efficiently using electricity and getting the nitrogen off it, and you can do it at an instant and pump it in the chambers. You don't need to get tanks and everything. And that chamber we have in the in the clinic that weighs 20,000 pounds goes to can go up to 3 easily. But that's the difference. The soft chamber you just can't handle the pressure.
You can't.
The advent of the oxygen generators and the advent of these 2 atmosphere chambers that are solid, hard chambers that you can get in your home, those are really great for people with chronic conditions.
Okay.
And then if they can get that in their home, that's kind of a sweet spot where if you're at 2 atmospheres and you're generating 95% oxygen, and you can fall asleep in there, you won't get oxygen toxicity, you won't have a seizure, and it's very effective still. It's still a lot of pressure and still a lot of oxygen. It's a lot of therapy. And yet, if you fell asleep in this thing and you're at 3 atmospheres and breathing 100%, you might all of a sudden start seizing and you might,
Got it.
and you can't get out of it. It's like, but so that's probably not something you'd want in your home unless you had an attendant. And one of the things that I found extremely exciting about the hyperbarics and related to ear, nose, and throat is the amazing efficacy in a sudden hearing loss. It's kind of an unusual phenomenon, but about 30 to maybe 60 people a year in South Dakota will all of a sudden lose their hearing. Like, bam, it's just gone. They wake up or it's gone. Now, about half of those people will have a dizziness along with it. And so you hear about people getting labyrinthitis and they think they're going to die and the room is spinning. Some people will get just a dizziness, they get vertigo and they say, what the heck, they're spinning and dizzy, puking, no hearing loss. And half of people, all of a sudden, they just get hearing loss and they're not dizzy. And then half of people get both. It's a labyrinthitis either way, but one time it's just hearing, one time it's just balance, or it's both. The frustrating thing is that people go in to see their doctor or urgent care or something and they think they're having a stroke or something, and then people look in their ear and they're kind of, it's late and they're like, oh, I think you have fluid there or there's wax there or something, and they don't have any other neurologic symptoms, they don't have any weakness or stroke-like symptoms, they just can't hear. And so they get put off as a fluid behind the eardrum, which happens, or maybe there's wax in there, they can't see and it's late and you're working, I know how it is working late, emergency room care as moonlighting when I was in residency. It's just like whatever it takes to get them out of the urgent care center. The diagnosis gets delayed and it's very, very common. Then they come in and see me a month later. The other thing we've shown is that if you put them in a hyperbaric oxygen chamber, literally pushes the oxygen right to that nerve immediately, and that nerve's just sitting there holding its breath because it's all inflamed, and it can feed that nerve and it can make a dramatic return, especially you get those people in early. This patient of mine, it was a 47-year-old lady, and it's really kind of piqued my interest in this. So she lost her hearing 5 years ago in her left ear, stone deaf, profound loss, got steroids, that was it, never came back, no response, she just is deaf in that ear. She comes in to see me and she loses her hearing in her right ear, same thing, profound deafness. She's stoic, she's crying, tearful, she's with her husband, she can't hear a thing. She's just stone deaf, comes into the clinic crying. She knows what's going on because she had that. So we do an audiogram, there it is, that proves it's a nerve loss. It's not because the eardrums look perfect, everything. We were able to start her on prednisone, oral prednisone, and put high-dose Decadron behind her eardrum under a microscope. I put that in and let it soak in the oval round window, get that in there, and I got her into this chamber that same evening. So, and she started hearing like the day after. She could hear stuff. Now, it's anecdotal, but she came back and from a profound loss all the way down here at the very bottom of our charts, she bounced back to basically normal hearing in her ear. Now, the other ear, it was, that was beyond repair because it happened so long ago. So her other ear is still deaf and her right ear is perfect. She's got perfectly normal hearing, 100% speech understanding, and she's within normal limits on that ear. And I cannot attest that to just the steroids.
My name is Grace Hochstetter, and I'm from Sioux Falls here. My story is that I found you, we had been on vacation for about 6 weeks, and 2 days after we were back, I lost my hearing in my left ear. And so I found you by just doing some research. I looked at PubMed, and when I found you, Midwest Hyperbarics, and I saw your name, I'm like, that's my old neighbor. I'm like, this is going to be great. So I called you up, and I was so glad that you answered. And I told you my story, and you got me in right away. On that Friday morning, you opened up at 7:15 for me, and it was just, I was just so excited to get in and get some treatment for my hearing loss, my sudden hearing loss. I woke up in the morning and right away I could tell something was wrong. My left ear, it was just like it was dead. There was nothing there, like there was a can over it, just a little humming or whatever in it. I made an appointment with a little bit of encouragement of my husband. I made an appointment with an ear, nose, and throat doctor and went in, and they did a hearing test on me, and my hearing was down to 3%. My first thought when I saw the chambers, I'm like, oh my gosh, what am I getting myself into? But I tell you what, when I saw you and your smile on your face, and I thought, okay, everything's going to be fine, and you put me at ease, and you were so wonderful. You were so wonderful to work with. You made me so comfortable or whatever. So the nervousness kind of went away right away. But going into the chamber was a little different experience or whatever. I guess I was more concerned about my ears popping and not being able to release that. But you sat there by the chamber and you were great. You just talked me right through it or whatever. So it was a good experience for me. It was so relaxing. Going into the chamber was so relaxing. I remember you guys putting blankets on me or whatever and finding the TV channel that I wanted. It was so relaxing. I mean, you forget that you're even in the chamber. It was so relaxing. Long story short, when I went back for my hearing test, I'd gone from 3% to 95% in my hearing coming back. And I felt like I was truly blessed to find you. And I was so happy, to have that hearing come back. It was like a miracle to me. It was,
Any neuropathy, any post-stroke patient, any post-heart attack patient, in there, if they can get them in right away, you're going to cure it. You're going to fix some of that tissue.
I started the Hyperbarics, and immediately after the first couple sessions, I had a lot clearer thinking. Prior to all this, there was a lot more anxiety and depression. All of that slowly started to subside. And the sleep was the biggest thing. I was also still am on a weight loss journey. And I noticed a lot of, how do I word this? My results were showing a lot quicker. I am a recovering addict. So I have, coming up this January, I will have 4 years clean. And every day was a struggle. And there's battles no matter where you turn. And I drug my feet a lot. And every little thing was difficult. There was no want to continue on. I had to do this. There was no want. And I had no idea what I was walking into, but as soon as I started, little by little, there was the progression of, I was happy to wake up in the morning. Everything didn't seem like an obstacle, and I was happy to do things again. I love cleaning, and for a long time I drug my feet, and I was able to start doing those basic things again with a smile on my face and feel like I had a purpose again because I was contributing, but I also felt like my worth had come back, and staying sober wasn't a chore. It was something that I was proud, and I felt like I was strong again and I could do it. And every day wasn't a battle anymore. There was joy again in my life.
But people with addiction issues, how it changed where they're like, I just don't even want it anymore.
Yeah.
And so, I mean, when I saw just the wide spectrum of everything, ADHD, anxiety, depression, you name it. And just anyone that just is already healthy, but they just want to feel even better.
This past January, I had a really bad neck injury, herniated and bulging disc from C2 to 7, and we needed some kind of help really quick. And so we knew through LifeVantage, Nicole, and so Nicole and Michelle were talking about the benefits and how it potentially could help. And so we called up and said, how soon can we get in? Yeah, so that's the weird thing is there's nothing I can pinpoint that happened. I woke up to go to church, had kind of a stiff neck, And by the time I got back from church, I was literally laying on our kitchen floor, and it felt like I was being electrocuted on the left side of my body. And I was green on the floor, and we didn't know what had happened. The doctors think that potentially was just years and years of injuries that the body had kind of been dealing with, and then all of a sudden said, we're not going to deal with this anymore. It's your turn. So we went to one of the major hospitals right away to get MRIs and see what was going on. That's where we saw the herniation and the bulging discs. They immediately wanted to do surgery and fuse from C2 to 7, and that was the last option for us. We wanted to explore kind of everything else that we could to see how we could help the body heal itself. And we truly believe when the body has what it needs, the body has amazing capabilities of healing. So I would say out of everything that I've done, and we've done a lot, Hyperbaric was the one thing where I could bring the pain level down to 0. I would suggest anybody that has the ability with something that they're going through to try this before they go to certain things that they can't undo later. But when I came into the clinic here, that was like 2.5 to 3 hours that having no pain, my body could relax a little and I would get some solid sleep.
But you sat there by the chamber and you were great. You just talked me right through it or whatever. So it was a good experience for me. It was so relaxing. Going into the chamber was so relaxing. I remember you guys putting blankets on me or whatever and finding the TV channel that I wanted. It was so relaxing.
So one thing I guess I've noticed that from the stories that we hear from patients to even your backgrounds and what brought you here, it feels like this place brings a sense of hope for many people that maybe have lost a little bit of hope and they feel like there isn't anything left that they can do to heal. Hyperbaric oxygen treatment is available here in Sioux Falls in the region, and you guys have an incredible facility with all kinds of different chamber options. So anything that you'd like to add to that as you think about the hope that you offer people or your patients?
I think sometimes by the time we see these patients for wound care, they're coming in and they don't have much hope. And that's something that, you know, we'll carry that hope and that promise for you until we can get you over that hump and make you feel better.
Hey, that's our show. If someone came to mind while you were listening to this, if you thought, hey, my sister needs to hear this, or I should send this to my mom, or my buddy would get a lot out of this, please share it with them. Just hit the share button and send it their way. You never know what one conversation, one episode, or one piece of information can do for someone who's been looking for answers. And if you haven't subscribed yet, please do it now. It takes 2 seconds, it's free, and it means you won't miss an episode. We've got incredible stuff coming up, and I don't want you to miss any of it. And if you're a health or wellness provider and you want to be on the show, we'd love to hear from you. There's a link in the show notes to get in touch. We're always looking for people doing interesting work who want to share what they know. And one last thing, I get asked all the time about the products and brands I actually use, so I put together a list of sponsors and favorite products that have worked for me and my family. If you're curious, that link is in the show notes too. Thank you for being here, and I really mean that. I'm Melissa Goodwin. The line is open. See you next time.